Hey, Will Ferris with Myopain and Eureka Seminars. So when I first started dry needling glutes, I would always try and palpate in prone or sideline, but I had a really hard time palpating for trigger points since there wasn't a firm backdrop to push the muscle up against.
A muscle like the infraspinatus, though, is pretty easy to palpate for trigger points because there's not too many layers on top of it and it's right up next to the scapula. I always make sure to check the muscles in the posterior hip if I have a patient who has pain or tightness during a flexion external rotation stretch, and also if they have pain during flexion, adduction, and internal rotation. This can obviously create a pretty nice pinch in the anterior hip with these patients, and you'd be surprised at how often loosening up muscles that are antagonist to flexion, adduction, and internal rotation, i.e. the posterior hip muscles, can help out with that pinch. So if I want to palpate the posterior hip with a patient that has pain in flexion and external rotation, I put them in sideline, flex the hip, and drop the lower leg off the edge of the bed so that they are pre-positioned in the position that was painful for them. If there's something back here that's limiting this position, I'll probably be able to palpate it better with a bit more tension on whatever the limiting factor is back there. In order to do this for the flexion, adduction, and internal rotation position, just flex the hip with the patient in sideline, and then place something under the foot to put them in internal rotation. This works wonders for my palpation exam back in this area.